Assalamualaikum warahmatullahi wabarakatuh. Madam Sharifah Nabilah. My name is Muhammad Lufi Hadi Muhammad Yusof. My matric number is MS17. I am from group Jabal Al-Hayyan. We are going to present about HIV and prevention measures. My team member is Nora Ana binti Osman, MS67. Rashita Banu binti Abdullah, MS50. Nizatul Akma binti Ayub, MS20. Nadiatul Irdina binti Zakiran, MS33. Daniel Shah bin Muhammad Nazri, MS3. Nur Syahida Asnina binti Abdullah, MS66. And me, Muhammad Lufi Hadi Muhammad Yusof, MS70. I'm going to talk about index. Topic number 1 is introduction to HIV. Topic number 2, how HIV transmitted. Topic number 3, statistical HIV in Malaysia. Topic number 4, how to prevent HIV. Topic number 5, what you should do if you have HIV. Topic number 6, association and help. Topic number 7, conclusion. I'm going to pass to Nizatul. Thank you.
My name is Nizatul Akma binti Ayub. My matric number is MS20. Introduction. History of HIV. The Institute of Human Virology (IHV) was co-founded and is directed by Robert Sigalo, MD, the eminent scientist who became world famous in 1984 when he discovered that HIV was the cause of AIDS and developed the HIV blood test. Pre-1980, it is widely believed that HIV originally in Kinshasa, in the Democratic Republic of Congo around 1920, when HIV crossed species from chimpanzee to humans. Up until the 1980s, we do not know how many people were infected with HIV or developed AIDS. What is HIV? HIV is human immunodeficiency virus. Is a virus that attacks cells that help the body fight infection, making a person more vulnerable to other infection and disease. It is spread by contact with certain bodily fluid of a person with HIV, most commonly during unprotected sex or through sharing injection drug treatment. If left untreated, HIV can lead to the disease AIDS, acquired immunodeficiency syndrome. HIV life cycle: free virus, attachment and entry, penetration, reverse integration, transcription, assembly, budding, immature virus break free of the infected cell, maturation. There are two types of HIV. HIV type 1 is the most common type of HIV. It attacks your body immune system. The virus destroys CD4 cells. The cell help your body fight infection. HIV-1 can severely damage your immune system and leads to AIDS. HIV type 2, mainly in West Africa, slower progression compared to HIV-1. Only 79 cases was found in USA, mainly affect Africa-born. I will pass this presentation to Rashita. Thank you. Before we start, let's watching compile video from us.
Okay, Habi, tonight I get HIV from unprotected sex and I practice an inverted relationship.
Mok, come over to my place, Mok. I prepare your shot already. I taste already. Barang baik punya. I got HIV because I'm a druggist. I share my equipment with other druggists.
booking ya. Hotel tamu, room 124, 10 PM. Untuk servis, I akan charge you RM100 per hours. Deal? Alright, see you. I get HIV do random sex with multiple sex partner.
Me and my husband have a wild lifestyle and we got HIV, also our baby too.
I got HIV reading. Follow SOP will handling HIV sample.
I am victim. I get HIV from wrong blood transfusion. It happened when we not responsible in their action.
You get me high, I know right away. We be chasing our hearts till we end up falling. Young and alive, we were runaways in a wasted summer.
I am an alcoholic. I get HIV from unethical activity where I lost my conscience.
It's unprotected sex. So it will happen when you're having a vaginal or oral sex with an infected person without using a condom or any medical treatment. So the second thing is mother to baby transmission. It usually happens when mother having a HIV and or maybe on their delivery time or breastfeeding time maybe baby will get, but it usually won't happen. It will happen also 15 to 45% only. But from there we are known the mother must be precaution yourself first. The third thing is the injection sharing. Usually this will happen for drug dealer. The drug dealer will share the injection to take a drug. From this we should know injection can't be shared because from the HIV can stay in blood 42 days maybe depending on temperature. The fourth thing is wrong blood transfusion. It will happen. It usually won't happen, but it's a less happen. The donor will never check a HIV test, then they actually go and donate the blood. Maybe the donor will have HIV, then the receiver also will get the HIV. The last thing is the skin one. The skin one will happen when you have a skin one. The person beside on you also having a skin one and HIV infected person. So from there we get a HIV. So from this we must know HIV not stay in blood also. Other blood, other fluid in our body. The second part. So they have a few symptoms. So I will tell about the early symptoms. From the every viruses or bacteria when you is in the body, it will get a fever, throat pain, nausea, joint pain, something like that. But HIV also the same symptoms will happen. So, but the second stage, they have a stage. So the second thing has we can get infected skin like this, maybe in the mouth, in the skin, in your toe, like this. The third thing, we have a stage 1, stage 2, stage 3, stage 4, and a stage 5. Stage 1 is a common like a fever, joint pain, that's all. The second stage is a symptomic. So it is like this one. You have a symptom on your skin, mouth, like cancer. The third thing, you should take a HIV test because it becomes worse. The last stage is a stage 4. End stage, it's called an end stage. Maybe you will arrive, maybe not a long day. The last stage is a death. After that you can alive too. That's all.
Assalamualaikum. My name is Nur Shuhaida Asmidah. My metric number is 66. From the graph we know we know HIV started in 1985. On early years of the graph, the case increased, but not too much. But in 2002, the case increased 7,000. This is the hard amount of the case. From the years after 2002, the case start to decrease until now. It still in same. From the graph, we know after 2002, the case are not too much, but still have case. By this graph, show the HIV case by state. And KL 12.5 the least HIV case. Labuan 0.4. This is HIV graphic in Malaysia. HIV case started in 1985 and the number of cases decreased in 2002 to almost 7,000 cases, and the number of the cases decreased in 2009 by 2,002 cases.
How to prevent HIV? The best way to prevent HIV is not have vagina, oral or anal sex, or share needles at any time. Sharing needles for any reason is very risky. If you have sex, lower your risk on getting on STI with following steps. Use condoms, get tested, limit your number of sexual partners, get vaccinated, don't touch it, remove some of normal bacteria in the vagina that protects you from infection. This may increase your risk on getting HIV and other STI. Do not abuse alcohol or drugs, pre-exposure prophylaxis, post-exposure prophylaxis, and antiretroviral medicines. If you inject drugs or medicines, follow these steps to lower your risk of getting HIV. The first one, never use or share needles, syringe, water, or drugs preparation equipment. The second one, they only use needles and syringe that you get from a reliable source, such as drugstores or needle exchange programs. The third one, use a new sterile needle or syringe each time. The fourth one, if you must use a needle used by others, clean it with bleach before using it. The fifth one, if possible, use sterile water or to prepare drugs. Otherwise, use clean water from a reliable source, such as fresh tap water. And last one, clean the injection seat with a new alcohol swab prior to injection. Next, prevention of mother-to-child transmission. The encompasses all stages of pregnancy from antenatal to postnatal care. Key to its success is early intervention where it is possible to prevent transmission at the time of delivery. You stand a better chance of growing, so if you start treatment the moment your pregnancy is confirmed or earlier, the appropriate prenatal care, including the use of antenatal viral therapy for both mother and child, the risk of transmission is now less than 2%. Means, penularan yang pencegahan dapat dilakukan oleh ibu terhadap anaknya dari proses kehamilan hingga bersalin dengan perawatan perinatal yang sesuai, risiko penularan dapat dikurangkan kepada 20%.
What you should do if you have HIV? First, taking care of yourself first. Second, taking your medication on time, like taking antiretroviral treatment. Second, start your treatment immediately from the hospital and attend all treatment appointments. Third, eating healthy and balanced diet like an organic food. Fourth, living healthy lifestyle. Fifth, minimize drug and alcohol use. Fifth, managing stress and get support. The Body Shop HIV and MIP. HIV is not transmitted through which is kissing, sharing food and utensils, sneeze, cough, sweat, tears and urine, caring for someone living with HIV, insect or animal bites, intact external such as hugging, shaking hands, sharing public amenities such as toilet, swimming pool, and the last one is sharing space.
Assalamualaikum and selamat pagi to Madam Bella and fellow classmate. I'm Nara Ana Uthman with metric number 67. I'm going to present about association and help. What this association and help will do to our HIV patient. Besides, you have to take all your treatment, go for your appointment, taking your medication. You also can go to few association for your psychology support. We have a few association, main association that in charge for HIV patient and community. We have MAC, Majlis Aid Malaysia or Malaysia Aid Council, was established 1992 under the Ministry of Health or MOF. We are mission to represent, mobilize and strengthen NGO and community who are working with HIV and AIDS issue. Besides that, we have Malaysian AIDS Council or the Malaysia AIDS Foundation, where they are mainly in charge on giving you support psychologically, financial help from available bodies that around. We also have CLAS, Kuala Lumpur AIDS Support Society. We also have a Pink Triangle Foundation. It's a community-based voluntary, non-profit making organization, provide HIV or AIDS education, prevention, care and support program, sexual health and empowerment program for vulnerable community in Malaysia. Besides that, we have APACASO, Asia Pacific Council of AIDS Service Organisation. We have Tenaga Nita for who fight for human rights organization, dedicate in existing building advocating and protecting migrants, refugees, women and children from exploitation, abuse, discrimination, slavery and human trafficking. Persatuan Pengasih Malaysia, where is for drug addict. This is a rehab center where they will help you to overcome your addiction and also guide you how to live daily life. We have Community AIDS Service Penang, CAS, Federation of Reproductive Health Association Malaysia, PAHAM, Islamic Medical Association of Malaysia, PIPIN, Sarawak AIDS Concern Society, Women and Health Association of Kuala Lumpur, WAKE, Persatuan Perantaran Pesakit-Pesakit Kelantan, Sahabat, Pertubuhan Edukasi Masyarakat Terpinggir or a non-government organisation for marginalised community. Beside all that association help available for you, and then prevention method, poster about why HIV is a bad epidemic for you, is your choice. Either to continue to live as a HIV can be avoided if you choose a healthy lifestyle. Hashtag kita jaga kita. Thank you very much. Now I'm going to pass this presentation to Lutfi Hadi for conclusion. Thank you.
I'm going to talk about conclusion. As a conclusion, we know that HIV is a disease that causes by contact the infected blood or from one mother to the child during the pregnancy. HIV can be spread by having sex, sharing needles, and blood transfusions. To prevent the HIV from spread from someone to other people, is use a clean needle and tell your sexual partner that you have HIV before doing sex. and thank you.